right, thanks, Tyler. November is Lung Cancer Awareness Month. Lung cancer is by far the leading cause of cancer death for both men and women. Shelby James and Dr. William Salisky join us now in studio. And Shelby, you are a lung screening nurse navigator at Carmichael Imaging Center. Explain the screening and how that works.
Okay, so lung screenings are for smokers and former smokers. So if you are between the ages of 50 and 77, either a current smoker or a former smoker that's quit within the last 15 years and have at least a 20-pack year smoking history, so like a pack a day for 20 years smoking or half a pack a day for 40 years smoking. If you meet that criteria, insurance will likely cover a free screening each year of your lung CT scan to have a screening. So it's something that we want you to have done yearly, and if you meet those criteria, it's a good idea to start getting screened.
Is this a simple process?
Yes, it's a CT scan of your chest. You lay down on the table. There's no IV sticks. Don't have to change out of your clothes. You do need an order from your doctor, though. So if you meet that criteria, or if you're unsure, you could check with your doctor about sending an order over for that, and we can discuss it.
And Dr. Salisky, as a pulmonologist, once those screenings are done, that's where you come in.
Sure. Let me say that we need to screen a lot more people. Only 6% of eligible people right now nationwide are being screened, unfortunately. So we have a lot of work to do. Shelby, she's in charge and does a great job. But once they're screened, and we do pick up cancers, and Shelby will give you those statistics, but once they're screened, then they'll come to us, and then we'll do an appropriate workup looking for cancer. And early detection is the key, because the early detection saves lives.
Why do you think people are hesitant to get this screening?
You know, some people just don't want to know. I have patients that are smokers that are increased risk, and they'll say, you know, doc, I'd rather not know, but we are saving lives when we get them earlier.
Yeah, people will say ignorance is bliss, but knowledge is power, right?
Absolutely.
Talk about what happens once that screening is complete, and how successful are you with these screenings?
Yes, so far this year we've done about 1,500 screenings, and we found about 30 cancers. So the goal is, to catch cancer early, so that's why you need to get screened yearly. And once you have the CT scan done, the results come to me, and I can help get the results to your doctor, make sure you get the follow-up care and treatment if needed.
Now talk about that follow-up care and the treatment, and how the technology has advanced to treat lung cancer patients.
Absolutely. We've made such strides in cancer treatment now. My cancer brethren over the past 5 to 6 years are just over the moon with our new treatments, with amazing strides. Our technology to diagnose cancer, navigational bronchoscopy that we have right here in Montgomery that our group does, is phenomenal.
You mentioned smoking, but what are the other risk factors for lung cancer?
Well, unfortunately, COPD is a major risk factor. So having lung disease, still smoking, family history of lung cancer are all major red flags. So if someone's out there listening today, please contact your physician, send them to us, and we'll take care of you.
And there are people who've never smoked a day in their life, and they still get lung cancer. What are some of those warning signs that perhaps they need to get a screening?
Sure. Of course, hopefully before that's too late, but coughing up blood, chest discomfort, weight loss, just not feeling well, please seek care of your physician.
Yeah, and you cannot get a screening if you're having symptoms. So you have to be asymptomatic for a screening. If you're having any of those symptoms, you need to talk with your doctor about maybe a diagnostic CT. So lung screening is for asymptomatic people.
Yeah, remind us again who's eligible to get these screenings.
So current smoker or former smoker that's quit within the last 15 years. Age 50 to 80 is recommended, but insurance pays age 50 to 77, most of them. And then at least a 20-pack year history.
And if people want to get one of those screenings with you, how can they do that?
So speak with your doctor and have them send an order over to Carmichael Imaging. We can then check and make sure insurance will cover it for you. If for some reason you're outside of the criteria and you're still wanting a screening done, you can self-pay $99. You will still need an order for that, though.
And we know if someone is out there and they are a smoker, quitting smoking is the best thing that they can do for their health. There are programs out there to help.
Absolutely. And we'd be more than happy to help them.
All right, thank you both so much for joining us. We appreciate it.
Thank you.